Masturbation, often considered a taboo subject, becomes especially sensitive when discussing aging men. Yet, it is a critical aspect of male health, particularly as men grow older. While it may seem like a private, even insignificant matter, the truth is that the absence or cessation of masturbation in old age can have profound effects on the physical, psychological, and emotional health of elderly men. In this detailed exploration, we delve into what urologists have revealed about the consequences of stopping masturbation in later years. Chapter 1. Understanding masturbation in the context of aging. Masturbation is a natural and safe sexual activity that almost all men engage in at some point in their lives. For many, it continues well into old age. As men grow older, changes in hormone levels, especially testosterone, can lead to a decline in libido and sexual function. However, masturbation remains one of the simplest and most accessible ways to maintain sexual health and satisfaction. In the context of aging, masturbation serves several purposes. Maintains sexual function, helps preserve erectile function, provides psychological comfort, supports prostate health, enhances sleep quality. While cultural or religious beliefs may influence personal choices, from a medical standpoint, regular masturbation is often encouraged by healthcare professionals to maintain overall well-being. Chapter 2. The biological role of ejaculation. Ejaculation plays a significant role in male reproductive and overall health. The biological process involved the release of semen and contraction of pelvic muscles, which has benefits beyond reproduction. It clears the prostate of potentially harmful substances, reduces the risk of prostate inflammation, encourages the flow of fresh, oxygenated blood to genital tissues, helps maintain healthy testosterone levels. When elderly men stop masturbating, these functions may become less efficient. According to urologists, men who stop ejaculating regularly may experience stagnation of seminal fluid, which can contribute to discomfort, reduce libido, or even minor infections. Chapter 3. Psychological and emotional impact. One of the most overlooked aspects of masturbation in older adults is the psychological benefit. Self-pleasure is associated with mood regulation, reduction in stress and anxiety, improved self-esteem, continued sexual identity and confidence. For elderly men who cease masturbation, there can be emotional repercussions. Feelings of loneliness, inadequacy, or sexual irrelevance may increase. Mental health professionals and urologists alike emphasize that maintaining a connection with one's sexual self can be a powerful form of self-care, especially when dealing with age-related isolation. Chapter 4. Masturbation and prostate health. Prostate health is a major concern for aging men. Several studies have linked frequent ejaculation to a reduced risk of prostate cancer. According to research published in journals such as JAMA, men who ejaculate 21 or more times per month have a lower risk of developing prostate cancer compared to those who do so less frequently. The mechanisms are not entirely understood, but the theories include regular ejaculation helps flush out carcinogenic substances. It reduces the formation of prostatic calculi. It maintains the elasticity and function of prostate tissue. Urologists often advise that ejaculation, whether through intercourse or masturbation, supports prostate function and may aid in disease prevention. Chapter 5. Erectile function and circulation. With aging, erectile dysfunction becomes increasingly common. Masturbation can help maintain healthy erectile function by exercising the blood vessels and tissues in the penis. When a man masturbates, the following occurs: increased blood flow to the genital region, muscle contractions in the pelvic floor, stimulated nerve pathways that support arousal and response. If masturbation stops, these functions can diminish from lack of use. Urologists compare this to the concept of use it or lose it, highlighting that regular sexual activity helps maintain erectile capability. Chapter 6: Testosterone and Hormonal Balance. Testosterone, the primary male sex hormone, gradually declines with age. While masturbation does not drastically increase testosterone levels, the act of arousal and ejaculation can support hormone regulation and production. Elderly men who stop masturbating may experience accelerated decline in libido, fatigue, decreased muscle mass, mood swings, or depression. Maintaining a sexual routine, even in the form of self-pleasure, can contribute to hormonal stability and overall well-being. Chapter 7: Sleep and Relaxation Benefits. Masturbation often promotes relaxation and improves sleep, especially in older men who may struggle with insomnia or restlessness. Ejaculation releases endorphins and oxytocin, neurochemicals that help induce a state of calm and drowsiness. Studies show that men who masturbate regularly report better sleep quality. For elderly individuals dealing with sleep disturbances, this can be a natural and side effect-free solution. Chapter 8: Social Stigma and Emotional Suppression. Unfortunately, many older men are conditioned to believe that sexuality ends at a certain age. The result is social stigma and internalized shame around masturbation. When elderly men stop masturbating not by choice, but due to guilt or embarrassment, it can cause unnecessary emotional distress. Urologists and sex therapists advocate for open conversations about sexuality in old age. Normalizing self-pleasure helps remove barriers that prevent elderly men from accessing one of the most accessible forms of physical and emotional care. Chapter 9: Masturbation versus Sexual Activity with a Partner. While partnered sex has its own benefits, masturbation offers similar physiological and psychological effects without the need for a partner. For widowers, single men, or those with partners suffering from illness, masturbation may be the primary form of sexual expression. Urologists emphasize that the benefits of ejaculation are not limited to intercourse. In fact, masturbation is often safer and more consistent in later years, especially when physical limitations or erectile dysfunction make intercourse more challenging. Chapter 10: Barriers to Masturbation in Old Age. Several factors can make masturbation more difficult or less frequent in older men. Medical conditions like arthritis, diabetes, or cardiovascular disease. Medications that affect libido or erectile function. Lack of privacy in assisted living environments. Depression or cognitive decline. Understanding and addressing these barriers is crucial. Urologists encourage solutions such as medication adjustments, assisted devices, or therapy to help elderly men maintain their sexual routines. Chapter 11: Myths and Misconceptions. Many myths surround masturbation, especially in older age. It's only for the young. It causes health problems. It's shameful or immoral. It's unnecessary after a certain age. Urologists and healthcare providers have consistently debunked these misconceptions. Masturbation is safe, healthy, and beneficial at all ages. Educating older men, and their caregivers helps combat misinformation and improve quality of life. Chapter 12: How to talk to your doctor about sexual health. Elderly men often avoid discussing sexual concerns with their doctors due to embarrassment. However, open communication is essential. Urologists encourage men to ask about how age or medications may affect libido, discuss any physical discomfort during masturbation, request tips on maintaining sexual health. Healthcare providers are trained to offer non-judgmental support and resources. Chapter 13: Supporting sexual health holistically. Masturbation is just one part of a larger picture. Urologists recommend a holistic approach to male sexual health in old age. Regular physical activity, healthy diet, mental health care, relationship support if applicable, hormonal therapy when medically indicated. Incorporating masturbation into this comprehensive plan can enhance the effectiveness of overall well-being strategies. Chapter 14: Case Studies and Real-Life Examples. Several urologists have shared anecdotal evidence of patients who regained confidence, improved their prostate health, or alleviated insomnia by returning to a regular self-pleasure routine. One patient, a 72-year-old widower, reported that after resuming masturbation, he felt more energetic and less anxious. Another, aged 80, found that masturbation helped him reconnect with a part of his identity he thought he had lost. These stories reinforce the importance of maintaining sexual health practices. Chapter 15: A renewed perspective on aging and sexuality. The cessation of masturbation in old age is not inherently harmful, but when it's unintentional or based on fear, shame, or misinformation, it can negatively impact health. Urologists emphasize that elderly men deserve fulfilling sexual lives, whether through intimacy with others or with themselves. By understanding the biological, emotional, and psychological implications of stopping masturbation, men can make informed choices about their bodies and well-being. Rather than seeing it as a youthful activity left in the past, masturbation can be a continued act of self-respect, care, and vitality. Ultimately, healthy aging includes sexual health. Embracing this truth allows elderly men to enjoy richer, more empowered lives, physically, emotionally, and mentally. Chapter 16: The Role of Technology in Supporting Sexual Health. With the advancement of health tech and online resources, elderly men now have better access to tools that support sexual wellness. Educational websites, virtual consultations with urologists, and discreet online communities provide platforms for learning and sharing without fear of judgment. Apps and devices specifically designed for men's sexual health can offer guided exercises for pelvic floor strength, sexual education and awareness, monitoring of erectile function or libido trends, anonymous forums for support and discussion. Digital access can also reduce isolation, especially for men who may not have open communication channels in their daily lives. It enables more elderly men to maintain an informed, proactive approach to their sexual health. Chapter 17: Cultural Differences in Global Perspectives. Attitudes toward masturbation in old age vary across cultures. In some societies, elder sexuality is more openly discussed and accepted, while in others it remains highly taboo. These cultural differences can influence whether elderly men feel comfortable engaging in or discussing self-pleasure. For example, in Scandinavian countries, sexual health at all ages is often embraced as part of overall wellness. In certain Eastern cultures, traditional values may discourage sexual expression after a certain age. Understanding these cultural contexts is important for healthcare professionals working with diverse populations. Tailored education and culturally sensitive conversations are key to promoting healthier outcomes. Chapter 18: Partner Reactions and Relationship Dynamics. Elderly men in long-term relationships may worry about how masturbation affects their partner. Some may feel guilt or secrecy around it, even if their libido doesn't align with their partner's. Open, honest communication is essential. In many cases, partners are supportive and even relieved to know their loved one is finding a safe and healthy outlet. Urologists and therapists recommend couples consider shared understanding of intimacy needs, accepting shifts in sexual frequency, exploring non-sexual forms of closeness while honoring individual needs. When approached with transparency and empathy, masturbation need not create distance in relationships. It can coexist with emotional and physical intimacy. Chapter 19: The Future of Sexual Wellness for Older Men. As the global population ages, there's growing awareness around senior sexual health. The future is likely to see more inclusive public health campaigns, greater integration of sexual wellness in elder care, improved training for caregivers and healthcare workers, wider availability of age-appropriate sexual health tools. Urologists are at the forefront of this shift, advocating for a future where sexual well-being is treated as a vital part of aging, not as an embarrassing side topic. Chapter 20: Empowerment through Knowledge and Acceptance. Perhaps the most profound benefit of understanding the importance of masturbation in old age is personal empowerment. Elderly men who view their sexuality as valid, natural, and worth nurturing are more likely to take charge of their health, advocate for their needs, experience improved mental outlook, engage more fully in life. By replacing outdated notions of shame with modern, science-backed awareness, men can step into a stage of life marked by wisdom, resilience, and continued vitality. Masturbation, far from being a trivial act, is a reflection of self-acceptance and bodily respect. This knowledge empowers men not only to take care of themselves, but to inspire future